Hi everyone and welcome to Cronulla Beach Chiropractic's Move Well series. I'm Chris Solomon, chiropractor, and today we're going to be talking about the plantar fascia and its most common painful syndrome called plantar fasciitis or plantar fasciosis. It's a very common condition, affects about 10% of people over a lifetime. So today we're going to be giving a few definitions of what the plantar fascia tissue actually does, a couple of symptoms you might expect to get, what causes the condition, and then we're going to go over treatment and management strategies, stuff that we can do as practitioners like myself, and massage therapy can do, and also exercises you can do at home for yourself. So starting off with the plantar fascia itself. The plantar fascia is a band of connective tissue which joins the heel bone and the base of the foot. If we look at our anatomical model Slim here, we have a connective tissue which joins right here at the base of the heel, and it comes down here and supports, attaches into the base of the toes. And its major function is support of the arch and actually maintains the integrity of that arch structure during walking. As a result of this tissue being quite a tough band of tissue, when we walk it actually creates a bit of propulsive energy which helps us to actually step off. It's called the windlass effect. So moving on to some of the symptoms you'd expect with plantar fasciitis. The very, very common symptom is the sharp pain at the bottom of the heel moving forward through the arch of the foot. This pain is most pronounced first thing in the morning, the first few steps when we get up out of bed. It can also happen after you've been sitting down for a long period of time, those initial steps, which then proceeds to get a little bit better or eases off as you continue to walk around. In chronic conditions, we start to get some clicking and cracking occurring. That's actually tearing or rupturing of the tissue there, and over periods of time that causes what we know as very commonly known as a heel spur, where the body lays down extra calcium on the base of the heel bone to help to stabilise the plantar fascia at that stage. At this stage, the term is actually called plantar fasciosis. That's the term for the degenerative or chronic stage of the condition. Okay, so what causes you to get plantar fasciitis? The most commonly known cause is obviously overuse. Long distance runners, people spend a lot of time on their feet for work, whether that's stationary or walking around, and athletes get it a lot. But it does happen at all ages. It does happen as we get older, as the tissue degenerates, so it doesn't need as much overuse as we get older to create the same problem. The biggest other factors are more to things that we can actually control a bit more, and more to do with the biomechanics, such as overpronation or rolling in of the ankles. If your ankles roll in and you aren't stable through your arches, it creates more and more shear or tearing pressure in the plantar fascia, and over a period of time that tissue breaks down, and combined with overuse, we see a more rapid breakdown in that tissue and inflammation occurring. Obesity or being overweight is obviously going to contribute, because it's going to contribute to the load that tissue takes, whether you're overusing it or not. Other factors too go in is tightness of the calf muscle and tightness of the Achilles complex, because that muscle attaches to the heel bone at the back. If that's tight, it pulls on that heel bone and creates more pressure on the plantar fascia itself. So even though you may not have a poor arch structure, you may, via tight calves, by not doing enough stretching, creating the problem yourself. Poor footwear obviously fits in with the overpronation or the rolling of the ankles. If we're not wearing good supportive shoes that support our arches, then we're going to tend to see more breakdown of tissue. Conversely, high heels, which I know a lot of women are going to be complaining about, has a big contributing factor to this. Plantar fasciitis is much more common in women, and the basic theory behind that is of the use of high heels for long periods of time. The other big factor, which often gets left out of the puzzle, is what we term as poor alignment of the whole kinetic chain. What does that mean? That means poor alignment through the rest of your skeletal framework, whether it's hip and pelvic alignment due to poor core stabilisation of the lower back, whether it's poor posture in your upper back, whether it's an old knee injury that may be affecting the way you align your body all the way down. And if you've got alignment issues further up, we will tend to roll one ankle in more than the other to compensate for its tilting of your pelvis, for example, and that then creates the overpronation, which we talk about, being affected by problems further upstream. So treatment of plantar fasciitis is broken into a few different categories. Obviously, there's treatment that we call passive treatment, which is what a practitioner, such as a chiropractor or a massage therapist, is going to do to you to help to improve the condition. And there's active treatment modalities, which is stretching and exercises you do yourself. First up, the passive treatments. And in this area, we break the categories into two areas: fasciitis or fasciosis. Fasciitis is when it's acute, and that normally is actually quite short, even though the term gets a term bandied around as though it's much more common. Fasciitis is normally only the first week or two of this sort of condition, and like all acute injuries, we treat it with kid gloves at the time. We don't overdo the massage, we do some gentle massage, but we tend to treat it just like any other inflamed thing. Rest, so modification of your activities. You have to slow off your running or what you're doing for work that may be stirring things up. Ice to get the inflammation down, some taping to support it, some very gentle stretches, but certainly not strong stretches. Definitely wearing the supportive shoes to stop the ongoing pressure, so the correct footwear, and possibly an orthotic if you're already wearing one. You make sure you're wearing that. Mobilisation and adjustment of the foot joints is very handy in this stage because it can help to get rid of some of the inflammation without creating any more, without directly approaching the soft tissues. And obviously adjusting, as we talked about before, adjusting the whole kinetic chain. This helps to get the alignment of the body going better further up so that we can address the underlying mechanical problems, but it also has what we call a pain reflexive mechanism where we're slowing down the pain fibres from the foot to settle things down. When we talk about the more chronic conditions, which is what most of us see in day-to-day clinic and what most people actually complain about, is when it gets to the stage when it's past the inflamed stage. At this stage, we can be much more aggressive with the treatment. Heat obviously helps to get some more blood cells in there, red blood cells in there to help to get rid of the scar tissue. Deep tissue massage, dry needling, acupuncture, aggressive treatment protocols to get into that tissue and to help reorganise the connective tissue there so it becomes stronger and less likely to tear and rupture down the track. Adjustments, again, we talked about to get the joints moving in there, which will become dysfunctional and stiff in the ankle and foot complex, and also the whole kinetic chain again to improve the overall biomechanics of your body. Orthotics is when if you haven't been wearing orthotics in the past, this is where we'd look if orthotics are indicated about getting some orthotics in there to help support your foot in the long run. And then we look at our local stretches and our self-myofascial release, which we're going to display for you in a second. And again, the whole correction and rehab of the whole body framework, which is what generally causes these things to occur in the first place. Okay, so now we're going to look at some stuff you can do yourself to help treat plantar fasciitis with some stretches and some strengthening. So this is Phoebe, our massage therapist, who's going to display these exercises for us as I talk her through it. First of all, we're going to do some foam rolling of the calf and the Achilles complex. As I explained before, the Achilles and calf muscles get very tight often with plantar fasciitis. It's really important we address the tightness in that chain of tissues. So we just sit down with a foam roller underneath our calf muscle and lift by using your hands. You lift your hips off the ground and roll along till you find some really sore spots by taking the weight there. They'll be quite sore. They should be no more sore than a 4 or 5 out of 10. If you need some more pressure, you put the other leg over the top to create a bit more weight on it. And when you get the sore spots, you can create a little bit of a rolling from side to side. Okay, and doing that for a couple of minutes is a really great way to loosen up your calf muscles. If you don't have plantar fasciitis, a great preventative thing for tight calves. Okay, next thing is some direct self-myofascial release for the plantar fascia tissue itself. In this case, we use a ball. Standing or sitting with the ball underneath the arch of the foot and rolling along with a gentle massage. Again, 3, 4, 5 out of 10 for pain is the most you'd want to feel on this, and just working away in the tight little spots and just rubbing from side to side. Tennis ball will do the job, golf balls are very effective. This is a lacrosse ball, which is extremely effective, and doing that for a couple of minutes each night is a great way to get the plantar fascial tissue loosening up. Next thing is some stretches for this area too. So we stretch the calf muscles out. So a gastrocnemius stretch, in this case we stick the right leg back, heel hard in the ground, knee straight, and we're pushing hard in the ground with the heel, and then leaning forward with the hips, trying to make a smaller angle between the foot and the shin bone to stretch out this tissue down here. Hold for at least 30 seconds, preferably up to a minute to stretch that out. We can change the angle here of the foot, outside to get the outside bands, or inside to get more of the inside bands of the calf, so we can play around in those positions. Next stretch is for the shorter group of muscles in the calf called the soleus. In this case, we put a block or books or foam roller against the wall, and this time we're going with a bent knee, heel to the ground and trying to drive that knee as far forward into that door as possible. The same, stretch out these tissues here. Same thing, hold for 30 seconds to a minute and move around into different angles if it feels tighter in one of the bands there, inside, straight or out. Okay, next and the last stretch is a stretch for the plantar fascia itself. In this case, we put the foot directly against the wall, touching the toes, with trying to drive the ball of the foot, this part here, and underneath the heel, underneath the big toe, into the wall, and keeping a bridge through there, and we'll feel a really nice stretch, in this case right along the sole of the foot, and we'll stretch out that plantar fascial tissue. If you feel clicking or cracking, don't proceed, slow down, but if you feel a gentle stretch, continue for up to about a minute. So they're the major stretches and myofascial releases we use in the home setting for this, for the rehab of plantar fasciitis. There are much more we can do, but we normally like to give you advice on those sort of ones because they may be contraindicated depending on where you're at with the condition. We hope this has been informative for you regarding plantar fascial issues, and if you have any further questions, feel free to call us at our office, 9544 3100. Thank you.